All right. Welcome, everybody. We are now live on YouTube. Today, we have Charlie from AARP who will be giving us an update on the work that she's been doing. And then Mike Fisher from the Office of the Healthcare Advocate will be giving us an update on some legislation that's been moving. And then I'd like to end with having some space for people to talk about what they're seeing in the legislative process or what's going on in their world around older Vermonters and the issues that that affect them and make Vermont a really good place to grow old in. The goal, right? The goal in life to grow old. Thanks for being here, and I'll turn it over to you, Charlie.
Awesome. Um, Thank you all for taking the time to be here. For folks who I haven't met before, my name is Charlie Glisserman. I'm the Advocacy Director at AARP Vermont. I'm also joined here today by Laura McDonough, who is the Communications Director at AARP Vermont. She is on Zoom. And we're going to talk a little bit about some of the new caregiving research that we saw come through this January, and also AARP Foundation's tax aid program, which is supporting folks with tax assistance and preparation now through April. So I'm going to share my screen. Bear with me as I figure out how to do this. Okay, how does that look to folks? Look okay?
Looks good, yep.
Good.
Perfect. So I want to start off this presentation about the experience of family caregivers and paid family medical leave with an excerpt of a story from one of our citizen advocates, Tammy Smith of Westford. Tammy was a caregiver for both of her parents, with two of her siblings that lived in different parts of Vermont. And they traveled from different parts of Vermont. Oh, hi. Hi, Rebecca. I just wanted to let you know that you're unmuted.
Yep.
Do you have a question or we're...
No, I'm sorry. Keep going.
Okay, you're all good. I do encourage folks, if you have questions or comments, please feel free to speak up or put them in the chat. We can be pretty informal together today. So I'll just read some of Tammy's words because I think there's really there's nothing more powerful than hearing it directly from her. She said that losing your parents within a month of each other is hard enough without the guilt of feeling like you could have done more. Though we lost our parents 5 years ago today, I still carry that weight. We all could have provided better care for our parents if the strain of finances and work demands weren't weighing heavily on our shoulders. Paid leave would have made a world of difference at the end of their lives and for the rest of ours. So I'm going to share a lot of data with you today about the experience of family caregivers and support of paid leave, but I think it's really important to first recognize stories like Tammy's. These are the stories of so many different Vermonters, and those stories are really what's behind all of this data that we released in January. So the background here is that Vermont's population is continuing to age, and that the need for care from family caregivers as well as professional long-term care services will continue to increase. Most Vermonters want to receive care in their homes and communities. And part of that long-term care system are family caregivers, folks who are caring for their parents, their spouses, other loved ones in their homes. So right now in Vermont, we have an estimated 70,000 people providing unpaid care to loved ones. Now, that's a really significant portion of our population who's providing care valued at $1.2 billion each year. So these are folks who are working full or part-time, juggling other demands like caring for children with caring for older adults. And so this survey was really dedicated to thinking about What are the experiences of these caregivers? What do these folks need? And how can we support them in getting what they need? So I think first off, the experience of caregiving is incredibly common in Vermont. More than 1 in 3 people, voters, 40 plus, have experiences as family caregivers. The majority of those folks were providing care for a parent. The median age of a current caregiver is also 60 years old. So I think that's also important to note, that when we're talking about supporting older adults, we're supporting folks who need care and also folks who are providing care. So family caregivers provide a number of different services to the folks that they love, to support them with activities of daily living as well as instrumental activities of daily living. So things like getting out of bed and chairs, bathing and dressing, toileting. One of the activities that I think is, as you noted, most common, 94% of folks are providing social companionship. I think that's really important part of combating social isolation, which we see as a massive problem for older adults in Vermont. These family caregivers are really key in providing folks with the support that they need in daily life, but also combating social isolation. Most caregivers were working while they were providing care, with the majority needing to adjust their work schedule. About 1 in 4, a little bit more than that, also needed to take a leave of absence. And as you can see in the box on the right there, the majority of working caregivers who took a leave of absence, 74% did not have a paid leave of absence. They had to take unpaid time off. I want to stop there before I move on to the next slide and just see, does anyone have any questions or thoughts they want to share?
You might just have to speak because we can't see if you've raised your hand. So
Matthew, hi, I see you have your hand raised.
Does come.
Yes, I took care of that little issue for you. Yes, thank you for providing the data that seems like it's current, because, when we're discussing the data sets, of senior citizens, veterans, and our elderly population, that's like equity work, it's being skewed. And that's what, that's not telling us the whole story of where are the problems lie within, trying to perform, but also support these services across Vermont statewide, which I am doing currently, because of, it just, like, may have known, it's just, are there not enough workforce members to support this, or it just, there's a lot of rural communities out there that can't have the efficient means or resources to do or provide that work, because either it's pay or if they're just set in a rural setting in general, which Vermont is totally rural, and we have tons of problems with transportation and other things pertaining to senior citizens, veterans, and individuals that are, elderly population of Vermont. That's something to bring up. Thank you very much.
No, thank you, Matthew. I mean, that's exactly right. I mean, there are so many different things that are kind of going on here that are intersecting and impacting family caregivers. I mean, one of the things that you noted was, the rural nature of our state, healthcare disparities, including access to paid family and medical leave. That unmet need disproportionately impacts people in rural areas, folks who are less likely to have paid family and medical leave through their employers, and are also more likely to have longer distances to hospitals and other healthcare centers and services. And so juggling transportation and other support for their loved ones so that they can get that care takes more time, and therefore results in greater pressures for folks who are trying to balance that with work. Okay. Head on over to the next slide. So as we were just talking about transportation, there are a lot of current and former caregivers who have incurred expenses for different types of services that they're providing to their loved ones. Nearly 80% of these folks have spent money on transporting their loved ones, often to doctor's appointments, supporting with grocery shopping. Nearly half have spent money on home modifications to support their loved ones as well. And so if you look at all of these categories together, 92% of caregivers ended up spending their own money in supporting their loved ones. And so I think that's particularly important when we're talking about the financial insecurity that folks are experiencing. Hi there. That are experiencing when they're in a position to take unpaid time away from work, reduce their hours, or change their schedule, on top of potentially taking in less money in their paychecks, they are also expending more financially as part of their care. Unsurprisingly, all of this leads to a really significant amount of emotional stress on family caregivers. Nearly 3 in 4 said that they felt stressed emotionally. 72% said that they felt stressed in balancing their job and their family. A majority also reported that it was difficult for them to get enough rest. So these family caregivers do need more support. And one of the ways to support them is a strong paid family medical leave bill. So as folks may know, there is a bill, H66, that would create a universal state-run paid family and medical leave program. This bill was passed by the House in 2023, last year. It is now in the Senate Economic Development Committee. So these kind of questions were asked about this bill, H66, so the specifics of it, the eligibility reasons that include time to take time away from work to care for a family member with a serious illness. That would include up to 12 weeks of paid leave. So if you look at the slide here, this poll talked to folks about this bill, H66, and asked for their opinions of it. And, frankly, these numbers surprised me. I knew that Vermonters were very strongly supportive of paid leave. I did not realize that the support would be this clear and this strong. So nearly 80% of Vermont voters over the age of 40 support creating a state paid family medical leave program. That includes a majority of voters in every political party, every income level, and every county in the state. So what this says to me is really clear that family caregivers need additional support, and this is one of the ways in which they're asking for lawmakers to provide that support. One of the things that we speak a lot about in the context of paid family leave, or get questions about rather, is financing. And so we specifically noted in this research exactly how a paid family medical leave program like H66 would be funded through a payroll deduction that is split between an employer and an employee. For someone making $50,000 a year, that would result in a contribution of about $2.65 per week. So after sharing this information, we asked folks, do you still support the creation of a program now that you know that it's funded? Again, the majority of voters in every political party, income level, and county in the state supported this program, and 75% of all voters said, yes, I still want this program, even if it means that a payroll contribution is a part of it. So before I move on, I want to just see if anyone has any questions about paid family medical leave bill or this research or any comments. Okay. So other supports for family caregivers. We recognize that paid family and medical leave is a really critical part of this puzzle, but of course, family caregivers need more than just paid family and medical leave in order to provide adequate care to their loved ones and balance all the demands of their lives. As you can see here, folks report needing more information, needing more healthcare services and supports, needing respite care, job flexibility, counseling, financial assistance, as well as paid family and medical leave. You'd also see here something for potentially further conversation, that there is also very strong support for a state income tax credit for family caregivers. As you can see here, this also sees the majority of support across political parties. So other long-term care services. So an insight into Vermont voters 40 plus is that 8 in 10 voters would prefer to receive care at their home with support from a caregiver. 85% of voters said it would be important to have services that would help them stay at home. And 87% said that it would be important to choose where long-term care services were provided. So again, folks want to be able to age in their homes and communities with the people that they love around them. And so figuring out how can we continue to invest in long-term care systems as well as family caregivers to provide that support. These are a few of the services that were listed as very important by folks who were polled here. This includes end-of-life hospice, visiting nurses, Meals on Wheels, home health care aides, transportation, respite care, caregiver supports, and adult days. The majority of folks said that these were very important community services that folks need to have available to them and that the state government needs to invest in.
It's a good slide.
It's a very good slide. I agree. So this is all that I wanted to share about the poll today. I have a few slides of information about AARP Foundation's tax aid program. But before I move on, does anyone have any questions about paid leave or these data? Matthew, go ahead.
The data is, as we know, but that's Vermont data. How does the U.S. Census data intertwine with this? Because U.S. Census data gives us the money to provide these services. And we know that to be able to, for the state to provide these services, how the U.S. Census does things is ask individuals across a state what services are, needed the most. And I'm wondering, and this is just my thought, of how many individuals that are senior citizens, veterans, and so alike are left out from that census process, that the U.S. Census Bureau has been, having a hard time tracking down these members of the public to be able to provide those census data, so the state would not only know how much individuals are senior citizens, but how much the state gets from that contribute census block. Thank you.
Mm-hmm. So I would be happy to share some information and follow up that outlines the methodology behind this research, because I think that's important. I mean, it was a very it was very good research. Over 1,000 people were contacted as part of this poll. And so I think it is pretty representative of Vermont. If you look at similar research in other states that are looking to pass paid family medical leave services, you will see very strong support. Nationwide, there's very strong support for a program like this. So yeah, these are really great questions, Matthew. And while I don't necessarily have all of the info, I can definitely share that and follow up.
I'm sorry. Yeah, I'm sorry. I'm just asking what's the compare terminology between the U.S. Census data versus Vermont. U.S. Census data gives us the money to provide these services from the United States, so we can provide the services. That's what I was trying to say. How can that be, more evolved so we can get more members from the constituency or from the groups that we're trying to have, fill out those survey posts so we can get more money to the state so we can provide more broader services. That was the question. Sorry if
Oh,
that
yeah.
was confusing.
No. I mean, that's a good question. I don't necessarily feel like I have the answer. Does anyone else? This is above our pay grade, Matthew.
Yeah.
We don't know.
A lot of the funding is based on the census data that they collected a few years ago. And then I don't know if they update any of that through the U.S. Census Bureau that's actually tied to the funding, but maybe something we could look into for sure.
I do know that for Meals on Wheels, for example,
Right.
we're and the way that funding is distributed is based on local population estimates as well. There's what's called an interstate funding formula. I think it depends somewhat on the funding stream. In this case, I can speak up for OAA that we would have more local information that way.
Yeah, and it could be that we're at the
We're not just
minimum,
relying on 10-year census.
probably at
Yeah.
the minimum, and whatever the minimum is. I don't know if
Well,
if it's done
there's
that
a-
way.
Yeah, we're at the minimum for the big picture between the
Yes.
states, but we're also targeting more specifically within the state
Yeah.
for distribution of that money.
Good point.
Okay. Great. So much knowledge in this room.
And Charlie, will you send these slides to me so I can share them out? Great.
Absolutely.
Okay,
Yeah.
I'll do that for next week.
Okay, so I'll share some action opportunities at the very end, but let's talk a little bit about tax aid because it is in fact tax season. I know.
Just mailed my stuff in.
Very, very, very good. You are on it. So AARP Foundation, which is a charitable affiliate of AARP, is the kind of operator of the largest free volunteer tax assistance program in the United States. So entirely volunteer run and operated with a focus on taxpayers over the age of 50 or with moderate to low incomes. So AARP Foundation is providing tax assistance now through April 15th at various locations across the state. Tax aid volunteers are trained and IRS certified every year to make sure they understand the latest changes and additions to tax code. And in Vermont, there are over 200 tax aid volunteers, a small army. So during the 2023 tax season, Vermont volunteers contributed, I am terrible at reading numbers, over 6,000 returns in Vermont with refunds over $5.9 million. And so really what the tax aid program is meant to do is make sure that folks are filing their taxes and getting all of the credits and deductions that they qualify for to really put money back in their pockets. So there are a variety of ways in which folks can access tax aid services. We want to make sure that we are meeting folks where they are. Some of these options are listed on the slide here, traditional in-person service, drop-off. There are some remote options and online coaching as well, and facilitated self-assistance. So folks who schedule an appointment with a tax aid volunteer and complete their taxes on their own in person with the support of that tax aid volunteer. So how can folks access tax aid services? Laura, would you mind putting the link to the site locator in the chat here? So there's a really great site locator for tax aid where you can type in your address and it will show you the closest tax aid site that you can visit. There's also a chat bot there that can help you book an appointment or answer questions or transfer the conversation to a live agent if you need it. And so you'll see this is kind of a little screenshot of the site locator. So there are parts of the state where it's really, there's tax aid volunteers very close to you and are quite active. I mean, I was at the Barry Senior Center for lunch yesterday, and there were tax aid volunteers right there supporting folks. So it was really great to see.
Is this AARP specific tax aid? Yesterday I was at the University Mall in South Burlington and there was one with CVOEO. I didn't know if this was for all the different options that could be helpful or just these are AARP specific.
These are AARP specific, but I know that our tax aid program communicates with like 211 and other
That's great.
yeah, so that people who need tax assistance, can access it through AARP, or if they're kind of going through a different door, they know about the AARP options, as well as other ones like through CVOEO.
Yeah, it was great. The mall was bumping with folks.
That's awesome. I mean, if the U-Mall's bumping,
Sure. Not much left there, but the tax thing was bumping.
Matthew, go ahead. Do you have a question or comment?
Yes, sorry, computer lag. Yes, a question about this, does this intertwine with the Vermont Leagues of Cities and Towns of State of Vermont? Not just intertwined with the AARP site location, like you said, there's others, that are a partnership. How about public libraries? I know that's a big one that, that could get out the message quicker, and they can also host those sites too as well. I'm wondering why that's not also in here too as well, because that's the main area where individuals, senior citizens go to as a public library. I was wondering if there's data on that. That could also help us expand this program out further into like towns that need the extra help and capacity. Thank you.
No, thank you, Matthew. Laura, do you? Yeah,
Yeah,
go
I
ahead.
can jump in there. If you pull up that site locator on your screen, you'll see a large majority of the sites are public libraries. We have the Georgia Public Library, Burnham Library, Brownell Library, Dorothy Alling Library, Richmond Library, Greensboro. So we do work with the public libraries across the state, and they also promote them internally. Yeah, thank you, Matthew.
Awesome.
And one question about the Vermont Leagues of Cities and Towns. Is that also another avenue to promote this or try to send this out to local town municipal offices too as well? So they'd be made aware, because municipal offices, clerks also do this type of work too as well, sometimes on their own time. Thank you.
Yes, and that is exactly. We do send this out to all of the town clerks as well. Yes, they are involved in promotion and raising awareness. Thanks.
So Laura put some great links in the chat to the site locator. You can find more information, including the documents to bring to the tax site at aarpfoundation.org/taxaid. You can also call to get this information 1-888-227-7669. So again, I'll share this information and follow up so folks have it for reference. But I think that brings us to the end of our slide deck here. So you have some great info about tax aid in the chat. I also wanted to share the quick link that includes some action opportunities on paid leave if you are interested in sharing your story about how you didn't have paid leave and it impacted your life, or how you did have paid leave and it impacted your life positively. We want to hear from you. Your lawmakers need to hear from you. So please use that link to get in touch. And I want to just, before I hand over the mic, there are other members of the Paid Leave Coalition in this room. I see Meg, Mary, Mike, other real legislative champions on paid leave. Is there anything that folks want to say before we move on?
Okay. I'll say something.
Please.
I'm just really grateful for all the work that you all have done the last sessions and beyond, and for many years. And just keeping up the fight and the attention on the issue is really important. And I know everyone's been working really, really hard. So thank you.
Thanks.
Thank you.
All right. Well,
Okay.
thank you so much. I really appreciate your time today and presenting all this stuff. And thank you for sharing the slide deck, and I'll get that out. So I know that Mike Fisher has to run here pretty quick, but I do want to have a quick update, and then we'll open up the floor for some questions and leave some space for people to talk about what's going on in their world. But I'll just turn it over to Mike right now, and we'll come back.
Great, thanks, everyone. Mike Fisher, healthcare advocate. I think my job today is to give you a quick update because I've been here before to talk about our project to raise the eligibility for the Medicare Savings Plan. And so I think we're in good shape, is my high-level report. We have spent a great deal of time in front of House Healthcare, educating those committee members. And I feel confident that there is a strong majority of that committee that really wants to take a step forward. Also working around the building, spent a little time in House Human Services, certainly working over in the Senate side as well. I think my general high-level comment is I think we're going to be strong out of the policy committees and have our real fight in the Appropriations Committee. This year, the appropriations process is going to be a mess. Or is a challenge. But I wanted to say just a few words about sort of the frames of this conversation. I'm the healthcare advocate. I initially come to it from a perspective of we need like getting people access to care, improves their lives, improves the system, improves affordability for the system. Upfront care is the right thing to do. And overcoming financial barriers is the right thing to do. People shouldn't have to look at the economic choice when their provider says you need care. They should be able to get care for all kinds of reasons, human reasons as well as healthcare system reasons. But as we looked at the data, and maybe I've said some of this to you before, as we looked at the data, who are the poor people on Medicare? It just hits you in the face. Year after year after year of wage disparity hurts women, people of color, people living with a disability in a disproportionate way. Our poor elders are disproportionately in those categories, our women, people of color. And so, so the effort to address this ends up disproportionately helping those populations. But then the next step in this, as we look at, again, the numbers, as we contemplate the savings, again, we're going to be fighting for millions of dollars out of the appropriations process. But on a high level, if we add 10,000 people to the MSP programs and we relieve them of their Part B premiums, that's $20 million in the pockets of low-income Vermonters. On the other hand, and there are scenarios in front of us, if we can get 20,000 new Vermonters into this program, it's $40 million. And that leads me to a bit of a different frame. Yes, the other frames still fit just as much, but it's also, this is a poverty fighting tool. This is a way for us to address poverty in a way that I don't think there's any other proposals on the table that in the State House that is going to put money in people's pockets, whether it's about access to healthcare, whether it's about housing, whether it's about food security, all of the above. These are low-income people who, like I say, the system is stacked against them, and this is a way to put money in their pockets. On top of that, 20 or 40 million, depending on the number. There's also significant savings for them and their healthcare providers when they access care. If the value of the low-income subsidy, the feds tell us that the value of the low-income subsidy program is $5,300 per person. We think that might be overestimated, but the feds say it, so I'm going to use it. And so, if if we can get 5,000 new Vermonters eligible for the federal low-income subsidy program, is $26 million improved access to care. On top of the savings that they're getting from not having to pay their Part D premiums.
Mhm.
And on top of all of that, these proposals would help them with their out-of-pocket. Those new eligible for the QIMBY program, for the program that supports them in cost sharing, there are substantial dollars that would go into supporting them with their cost sharing expenditures. And in that one, it's really money going to providers on behalf of these people's care. And my very first point at the beginning, opening up the door, saying to them, we got your back, you can get care, you don't have to worry about the out-of-pocket costs. So the return on the challenge at the Appropriations Committee room is huge, and the return on investment is immense.
Mhm.
And so, I have to say, I look at states like Connecticut that have been doing it for some time, and I think somebody really smart looked at the lay of the land and how you draw down federal dollars and took advantage of it years ago and put hundreds of millions of dollars into low-income people's pockets and access to care in Connecticut. And it's going to take us a while, but we can do the same.
Thank you. This is really helpful. And I did share out the VPR piece that Peter Hirschfeld did that was really explained this well. And then also your presentation to the Human Services Committee, the slide deck for that. And if anyone wants a copy of that, glad to share it. It really draws your points. It's very true. Here in Vermont, we have to stop using state taxpayer dollars for programs that the federal government will fund, because other states are taking advantage of this and we're not. And it's not just in these parts, it's at DCF, it's even more pronounced. So, we have the opportunity to really take advantage of this.
Yeah.
And so,
and let me just mention one more thing that sort of comes into light. I forgot how much I hated this from years ago. I hadn't looked at it in years. Honestly, I was a member of the minority in the House when the legislature instituted premiums for Dr. Dinosaur. It was under Walt Reed, and at the time I remember thinking, boy, that's stupid. You're charging low-income people, and by the way, we do the exact same thing. We have premiums for people on VFARM, our prescription drug program for people on Medicare. Low-income people, we're charging them money to participate, and we share those premium dollars with the feds at the same match rate as we get for Medicaid dollars. So in other words, we're taking millions of dollars from low-income people and sending it to the federal government. And so it's just one of those things that it sort of smacked me in the face when I started to look at the numbers, and it reminded me of something I'd forgotten about, honestly. Just doesn't make sense. And so we have quite a lot of work to do.
thank you for that update. Really appreciate it. Yeah, Mary.
Just one more point, because we're all, it's very, very critical for older Vermonters. These affordability issues are extremely critical. And we're trying to tie our work to Age Strong Vermont, our 10-year plan, which prominently features affordability, including this very initiative, which was added to that plan as well. And so we call on all of you to support this. And Mike will let us know when the time is right.
And let me also just also, whatever happens this year, there's a lot of work to do in this space. It is cruel and unusual to have a asset test for MABD. Just cruel and unusual to say to people you have to have less than $2,000 for an individual or $3,000 of liquid assets. Other states have gotten rid of it, and as well the MABD income limits are also.
Can we say what MABD means?
I'm sorry, the Medicaid program for people on Medicare, the traditional Medicaid program. MABD stands for Medicaid for the Aged, Blind, and Disabled.
There's no asset test for Medicare savings for
There's no, yes, correct.
Mm.
I see Lila on the screen. I think Lila was part of health policy at the time when we got rid of the asset test for MSP. Thank you, Lila.
Yeah.
All right. Thank you so much for that update. I'm looking forward to seeing how we move it forward this session or set ourselves up for the next legislative session to really see this policy move. As we know, it's not going to be pretty in the appropriations process this year. So we'll do what we can and, hopefully get ourselves ready for the next legislative session on this. So.
Could I
Yeah.
say something before Mike leaves? This is Mary Alice Bisbee.
Hi, Mary
I'm
Alice.
familiar with him. I'm currently paying for $251 as a copay to the United Healthcare, and I recently got from Medicare a statement saying that I owe $259 more to the University of Vermont because they do not recognize, OneCare does not recognize United Healthcare. So I really would like to know more about MSRP so that I could get into it. I do have a few assets, much more than $2,000,
Yeah.
but if you can get rid of the assets test, I certainly am low income, I'm disabled, and I'm 87 years old.
Mary, I think the right thing to say is, I think you and I talked, and I think we determined that your income was just a bit over current MSP levels, and that this proposal, I think, might help you. But I think you also just said enough to make me say, would it be okay if I have an advocate reach out to you individually to talk through what's going on for you?
Yeah, well, Lila said I should testify.
Testify too, but you also said something about a bill that.
I know Lila.
But you also said something about a bill that doesn't make sense to me, and we should talk to you directly about it.
Okay,
Great.
thanks.
Good connection there. Thanks. Just before you go, I did have someone who emailed me a question who couldn't be here today and wondered if there was anything brewing around Medicare Advantage policies.
So there's a bill in Senate Finance, S230, I think is the number. And it is a little bit of a brainstorm of a collection of policies to try and address what we can on a state level about Medicare Advantage. I cringe saying the term Medicare Advantage. I don't tend to say that term. I say Part C. It's what it's called. It's not advertising, not an advantage. Addressing Medicare Part C and doing what we can on it. I want to be honest. I think that bill has an uphill slog in Senate Finance. It's not a committee that's particularly friendly to the issues that are being raised. But take a look at it. It largely, unfortunately, Dan, Part C law is the state is preempted on. The feds do it. So, looping back to the MSP project, if we can bring a bunch more Vermonters into the supports for cost sharing and Medicare premiums, that takes away a lot of the incentive and a lot of the box people feel when they say, how do I get coverage? Somebody is advertising to me something that sounds great, and there's a famous person telling me that it is great. And so supporting low-income people, I think, goes to that same direction.
One other thing,
Yeah.
too. There have been some incremental improvements at the federal level where they can improve the situation. They're small, but things like you can't lure someone who is in MSP into Medicare Advantage anymore. You used to be able to do that. There's been some restrictions on advertising. You have to make sure that you show it's a non-governmental ad, so there are some incremental things happening, but it's really at the federal level to address it.
All right. Hey, I'm going to have to kind of bring this to a close today because I need to be back in committee at 1:00 because we've got the budget for, we're having budget presentations. So, but I did want to give a shout out to Nate, who's been taking our Minutes, thank you so much. Nate is a student at UVM and an intern with Representative Toriano from Hardwick and Stannard. So thank you for your help. That's very awesome that you're here and doing that. So thank you for sharing those. And we'll see you all next week. Thank you so much for coming.
Thank you.
But I think I can stay put right here for my next meeting.